gonna be a meeting. Yeah. Way over yonder. Where we won't have to cry no more. Oh my Lord. We won't have to cry no more. I tell you we won't, church. We won't have to cry no more.
Hello and welcome to another production of Keep It Simple, Sir, Keep It Simple, Senorita, and Keep It Simple, Saints. I have the honor of being here today under the wonderful tutelage of Bishop Norton, and I thank him for allowing us to be here today. On the set today, we have a wonderful topic, but I'm going to open with our scripture and dive right in. Our scripture for today, it is, "He that loveth not, knoweth not God. For God is love." 1 John 4:8 tells us. Our today's topic is, why should harm reduction matter to you? I would love to introduce these beautiful women that we have before us today, and I would like to start on my left. Who do we have with us today?
My name is Dawn Schwartz. I'm the project manager for the Community Overdose Action Team through Public Health, Dayton, Montgomery County.
Wonderful. And next?
My name is Victoria Hubbard. I'm the project Dawn coordinator. I work for Samaritan Behavioral Health in 115.
My name is Colleen Oakes. I am the manager for the Montgomery County Prevention Coalition.
And my name is Brittini Long, and I'm lucky enough to serve under both Dawn and Colleen as a co-chair of the Opioid Prevention Branch and the Community Overdose Action Team's Education and Information Branch.
I am Dana Fleetham. I am the Director of U.S. Operations for BRAVE and also one of the co-chairs for the Montgomery County Community Overdose Action Team branch, harm reduction branch.
Yes. Wonderful.
And I am Sydney Silverstein. I'm an assistant professor in the Boonshaw School of Medicine and also a research partner with the Community Overdose Action Team.
Excellent. I am excited today because we have a wonderful topic and we're going to be sharing. So I want to share a little bit why I'm here today. One, I want to be informed. I want to learn about what is this harm reduction? What are we talking about here? And I want to educate and inform my community. Hey, there's some activities and things that you can be a part of. There's some prevention, and you ladies are going to share with us today. So you ladies, share with me, why are we here today? Why are you here today?
I'm here to hopefully help save some lives.
Yes.
Overdose and substance use disorder has skyrocketed in the last decade in Montgomery County, and harm reduction is really a way for people to be safe and get to another day if they are using drugs. So hopefully they'll reach that day where they're ready for treatment and ready to make changes in their lives.
Awesome, wonderful. Victoria, why are you here today?
I'm here because I care.
Yes.
I'm simply here because coming into this field, after working in corrections for 30 years and then coming to work under the harm reduction and getting to understand it, I didn't understand it. And so I think that it's very important that those in the community understand exactly what we're meaning when we say harm reduction. And simply it means we care.
Awesome. Anyone else? Would you care to share?
Sure. I'm here today to represent the Montgomery County Prevention Coalition, really because we know that the power of people makes such a difference here. And the Montgomery County Prevention Coalition includes everybody, reaches out to everybody in Montgomery County. Whether you use drugs, have used drugs, know somebody who does, just care about keeping the community safe, everybody can have a role in this conversation, and hope to bring that to everybody today.
Wonderful.
I'm here to educate and to help reduce stigma. Too many individuals who are in active addiction or experiencing substance use disorder are in that space alone and in the dark. And we need to shine some light on that and make sure that they know that there's help out there that's available.
Yes. Miss Dana.
Yeah, so I'm here because of love, because harm reduction essentially is love. It is recognizing that human being is just the same as you or anybody else, and giving people the tools that they need to keep themselves and their loved ones safe is absolutely critical in the current overdose crisis.
Yes, absolutely. Ms. Silverstein.
Well, I am, as a professor, I am an educator, but ultimately I'm here because I've lost a few friends to drug overdose recently, and it's made me feel motivated to be more outspoken. And I'm really passionate about the philosophy and approach of harm reduction, which I think there's no quick fix to any of the problems we're facing, but I feel like as an approach and as a philosophy, it is the one thing that gives me hope and some room to think about a better future. And so I'm really happy that you invited me here, and those are the things that have brought me.
Well, thank you all for joining us, and I'm so excited. I'm ready to dive right in. So let's start off with saying, what is harm reduction? What is it? Let's let our people know and inform them. Who would like to take that topic?
I'll start off, and I'd like to start off with what harm reduction isn't.
Okay.
Harm reduction isn't saying that your loved one or a person that it's okay that they're using drugs. This is addiction is a brain disease. It is a disease. We compare it a lot of times to diabetes or other diseases where they need the medical attention and assistance to be able to get into their recovery. So it's not saying it's okay you're using drugs. To me, it is saying if you're using drugs, please be safe so we can get you to that day where you're ready for treatment. Would you guys agree?
Yes. Yeah, absolutely.
Okay.
I mean, I would say every once in a while, even the approach of harm reduction might even open a space to say, in some instances, maybe it's okay that someone's using in the moment, so long as they're willing to make steps towards positive change in their life.
Yeah.
And leaving the path open for them to kind of reach their own conclusions about it too. Like, I think harm reduction as a movement is thought about reducing the harms of behaviors traditionally associated with adverse health consequences, like lots of risk, like lots of unsafe sex or injecting drugs. But really what harm reduction is a philosophy, and it's just an approach of radical empathy, as we've discussed. It's sort of saying no one of us is any less worthy of love and care and the kind of affirming thoughts that you are worthy. And so even if it's sort of putting aside our own feelings about someone's drug use or behavior and just kind of showing them that their life is valuable, and hoping that with that love they will be able to get to a place where they're motivated to make positive changes in their life, whatever that is, and just kind of having the faith that those positive changes will end up looking similar to what we have in mind. But even if that's not it, like, that's okay, because we want them to thrive.
Right.
And
I'm glad that you brought that up, because somebody who is in the midst of addiction and struggling with substance use disorder, they already feel alone. And they already feel unloved, and they feel guilt, and they feel shame, and they feel all of those negative feelings towards themselves. So, making it clear that they are worth the time, they are worth the effort. We hope that they get to the place where we'd love them to be, but until they're ready, we're alongside them to ensure that they stay safe and are able to progress, like Sydney said. And again, what she brought up, about harm reduction, yes, specifically today we're talking about harm reduction when it comes to substance use, but harm reduction is across the board. So whether you're talking about safe sex, or you're talking about substance use, or you're talking about being careful, of how fast you go, laws, traffic laws, that is harm reduction. So this is just a different aspect, or look at it.
So would you say it would be like an example? So we just had St. Patrick's Day, so them offering the taxi rides home. Would that be a form?
Absolutely.
And keeping people safe and off the road. So when we think of harm reduction, we have to include those things. So anything that's going to keep us safe.
Yes. Wearing a seatbelt, like she said.
Yes. Wearing a seatbelt. So having preventive tools in place, and we know we love them. And that's the whole part. So you mentioned something about this radical empathy. Let's dive into that. What does that look like for you, having the radical empathy? For me, it's going over and beyond and making sure my loved ones are safe today. And then not judging, like you said, and letting them know you have someone that would advocate, be there for you, stand by you today. So what does that radical empathy look like in your lives and your careers?
I think for me, oftentimes when people think about substance use and addiction, they have a picture of that person and what that looks like. And you often hear people that aren't educated and don't understand talk about those people. And it's really important for us to understand that those people are our neighbors, our coworkers, our loved ones. And until you are directly impacted, you don't always look at it through that lens. And so we need to see them as human beings, as Dana said, that are worthy of our love and our support. And so to me, that's really what radical empathy is.
And the opiate epidemic really changed the landscape of that too,
Yes, it did.
because you know, before there may have been more of a stereotypical person that uses drugs, but we saw in the opioid epidemic that it is literally the mom that lives across the cul-de-sac from you. It could be your doctor, it could be, you know, your plumber, it could be anybody, because it was born out of overprescribing. You know, pain medications, and then, you know, everything kind of being shut off. So understanding that radical empathy to me is, and this is something that I came across when I was still working in criminal justice. I worked 25 years in criminal justice and recently changed over to public health in this position. And for a long time, I saw people where I wanted them to be. And it was, I'm embarrassed to say, probably about 13 years into my career as a probation officer when I realized that I have to see people where they are, because they don't think the way that I do. They don't have the same background or the same upbringing or the same modeling opportunities that I may have. So expecting somebody who is reliant on the bus line and mentally ill and using drugs to be at my office at 9 a.m. and then punishing them if they're not, that's unreasonable.
That's correct.
So, you know, that was really a good look in the mirror for me when I realized that for 13 years I'd really been doing it all wrong. And that's kind of where the radical empathy comes in for me, is you're not going to react the way that I do because I'm substance free. And, you know, I have some abilities that you don't right now because of the situation that you're in. So,
Victoria, share with us, what does radical empathy look like for you?
Approachable. Simply approachable. To be that person that's going to stop, meet them where they are, even though where they are doesn't look like I want them to be, but meet them right there so that I can really, really hear them. Not process them, not access them, but hear them.
All right, I like that, being approachable. Radical empathy, what does that look like for you?
It makes me think of a quote that we talk about in trauma trainings a lot, and trauma awareness, that it's not about what's wrong with you, it's what happened to you. And so, and I'm sure that's a quote that Brittini brought into my life, actually. But just a reminder that everybody has a story, and something has brought everybody to whatever point in their life they are. And for us on the coalition, we work with youth. And so we started to hear stories of these kids that were young athletes, top of their class, excelled at everything they did, had an injury, had an opioid prescription, and that use turned to misuse, turns to abuse. Same thing that we hear some of our senior population that get confused, are unsure of what medications they're taking. And so Dawn talked about that it's a disease, not it's a disease, not a decision. And those are just the kinds of things that, as we're breaking stigma, we want to make sure that people understand, and how easy it is for people to get to a point that we may judge.
You mentioned that too about the seniors. My mother is at assisted living, and just educating them. One of the residents there, she held her medication, and she said, "Oh, I'll take it a little later," but she didn't realize, because she wasn't an educator informed, that she just doubled it by waiting to take it for dinner, and it was what you call an accidental overdose. And those things happen, so we have to be aware of this. So what does this radical empathy look like for you? Because I want to hear you too, Dana. I got to hear you. You're over there being quiet. I need to hear something.
So radical empathy is very much rooted in radical love. It is this construct of you just are going to unconditionally love that person and do the best to meet them where they are and not place conditions and strings and requirements and goalposts and all these things that are inaccessible, but you are simply showing up for them and being there where they're at and trying to resource them the best you can, no matter who that is, whether that is a person who is experiencing substance use disorder, a person who is a loved one, somebody who's just trying to build a better world. Like, you're going to meet them where they are and help to resource them however you can.
And breaking that stigma and understanding, I think that's a bigger part of it
Absolutely.
too, because we tend to judge and don't even realize it, and automatically it'll come. And I don't mean to. It's like, oh, well, what's wrong with them? Well, half the time I need to ask myself, what's wrong with you? It may not be them, it's just my lack of understanding and knowing. So I have to have that today. So I'm going to say, Dr. Silverstein, would you share, I know you talked about it a little bit, but give us a little bit more insight of that radical, because you really talked about that, and I love to hear how you hear about that.
Yeah, I mean, I think also too, like with the current opioid epidemic, we hear stories about people who are overprescribed or the athlete who got injured. But radical empathy is also looking to the person who was, in a juvenile justice facility at 15, because and recognizing that person has a story too, even if they're presenting, even people who have burned us, who have asked us for money to go to treatment and taken that money to go buy drugs. It's empathy for those people too, and recognizing unless we've walked in their shoes for the duration of their life, we don't know what's come before. And so unless we knew every single thing, then they are still deserving of empathy and care. And that framework has been liberating for me, because I think, so I do a lot of research and interviews with people who are actively using drugs. And I think in the beginning, I came in wanting to help or wanting to befriend, and I would feel frustrated or sometimes burned by people that I thought, oh, I tried so hard to help them and it didn't work out, and I felt a little bit of resentment or something. And then I realized, like, that is my personal ego getting in the way, and I felt much more liberated by this notion of more radical love, as Dana mentioned, or just empathy and understanding, like, they are on their journey and I am here to listen and suggest and try to offer resources or strategies and love, but to not judge, even if they have burned me, or even if they tell me aspects of their story that I find unappealing, or that's fine, like, that's not my life. I haven't walked in their shoes, but I am going to recognize that they've probably been through something. They don't have to tell me what it is. It doesn't have to be justifiable. And many people it is, it's like, it is important to recognize that there are people who are victims of a broken system in terms of, like, irresponsible doctors. Like, that is a reality. But then there's also, as Dawn mentioned, like, earlier waves of the drug epidemic, where we thought about stereotypical, what was that produced from? What kind of inequalities, mistreatment, lack of opportunities produced, drug epidemics only happening in poor urban communities, like in the 80s and 90s. What made it safer for middle class people to use drugs and not get in trouble for it? That's radical empathy too, is sort of recognizing and acknowledging the harms we've done by stigmatizing for so many years, and only now starting to think about, hey, this could be your mother, your next door neighbor. It's probably always been, but we haven't wanted to see it. And so that is what it means to me.
Well, and to build on that, this is the disease that those afflicted get blamed for. When somebody says that they have diabetes, you don't get the judgment that you do with substance use disorder, even though that diabetes could have been caused by the way that you eat, by your choices, right? Same thing with cancer. You don't blame the person for getting cancer. You just want to help them get treatment. And substance use disorder is that one disease where the person suffering is seen as the cause versus the patient. You know what I'm saying? So, and that's where that stigma comes in. If somebody has diabetes, they're going to take insulin if they need to. Well, this is a different disease where they need to take medication-assisted treatment. Instead of chemo, they're taking Suboxone or Vivitrol. So that's something to think about also.
Okay, so it goes into the next one too. We're going right along. So what are the risks that are involved with drug use, whether it's legally or illegally?
So really, all drugs can have unintended effects, and it doesn't make you a terrible human being or an incompetent human being because you took a drug and it caused an overdose. That doesn't say anything about your character or your personality, but it says everything about the drugs that you encountered. And while we know that like the risk of overdose is lower using like a so-called licit drug supply or like a legal drug supply, it's much higher in an illegal drug supply because that's completely unchecked. And so that raises the risk for a significant number of people, and it makes it a lot more important for those risks to be communicated and for the tools in order to mitigate those risks to also be shared and supported and like implemented in communities.
So it could be over the counter. I
Yeah.
could take too much Tylenol.
Oh yeah, you can
Absolutely.
you
Bad
can
for your
overdose
liver.
on acetam,
Yeah.
and
So-
you can do damage to your liver and other.
I don't think people know that. I don't think they're aware. So what are some of the other risks that you may see that's involved? Because it's not just the drug use. We want to talk about that. It's the over-the-counter meds and the prescribed meds that we have to be aware of.
You know, there's contraindications with prescribed medications. You know, if you're already taking medications and you go to a doctor for a different problem, and you don't tell that doctor that you're on certain medications, those medications can cause a problem or a reaction in your body. You know, when you're talking about overdoses, yes, there are some purposeful overdoses. Those are called suicide attempts, right? But all others are considered accidental because no one wakes up thinking, I want to overdose today. You know, I'm going to use so much that I'm going to overdose, or I'm going to make sure that I, use a drug with something like xylazine or, nitrazine, which, is causing a ruckus across the country, because I purposely want to overdose. All of them are accidental. And again, when you're talking about a disease and it being a brain disease, somebody with substance use disorder, they didn't wake up, like I said, and decide that they wanted to be an addict. They got caught up in the situation and their brain started to change to where their brain said, you have to have it, right? And so when your brain is saying you have to have it, you have to have it, you have to have it, that is more likely to lead to an overdose.
Well, and the stakes are higher now too. I mean, it used to be that if you were using an opiate, that it would have to be a significant amount in order to create an overdose. But
Probably not.
Right. So explain to me or share with us what are some other risks that may be involved with drug use, illegally or legally?
So really the stakes are higher now. It used to be that if an overdose was going to occur, it was more related to the amount that you were using and not that you were using at all. But now that fentanyl and carfentanil and all the other connected substances to that have entered the drug market, it's now possible to be using something completely unrelated, so like MDMA, ecstasy, or stimulants of any kind, and encounter fentanyl and be completely unprepared for it. So this is taking an overdose situation that was affecting people that were using already and using in different amounts, but now you could use one pill and that's it. You could have one night of experimentation as a young person and that's it. And that definitely changes the landscape that we're operating in now.
I think we need to highlight that and keep, especially with our youth.
Yes.
I know they're talking about the different drugs, the Molly, the Percocets, and all these different things, and it's in their songs, and they're hearing it all the time.
Yes.
But just letting them know and informing them that one pill, like you said, could have the fentanyl in it. It can have the other one that's even resistant to Narcan.
Yeah.
So not knowing what you are taking today. And I think a lot of our kids need to be aware of that. And just at our local high school, they had the gummy bears. And a young lady was going to bring them to school. Well, what happened is she got cramps, and they ended up taking her to the emergency room. When they tested her, they did a UA, and she tested positive for fentanyl, and she thought she was going to have gummy bears, and she was going to bring them to school.
Yeah.
Now imagine if she would have brought them all to school, and how devastating that would be. So our youth, please be informed, our youth. Do not take these drugs on the street if somebody's offering to you. If you need help today, we're going to give you all that information as well. But you guys, we really want to talk about those risks and what we see every day. I run recovery housing. So I house those people in my home. I get the calls from the hospital, the treatment centers. And I have, the youngest is 18. And just to see how devastating that is to their lives. But my empathy is radical because I want to house them and love on them. And then give them the attention and inform them and educate them. And then connect them with those resources. Hey, you have a story. Your life matters. You know, and how can I get you to your potential? What are your dreams today? And they would look at me and say, nobody's ever asked me that. I said, well, I'm asking, what is it? We want to find it. So just being aware and knowing, I get to see the consequence of it. I want to be on the prevention side and let people know, inform you, hey, this is out there. Do not take these little colorful pills because they look like Skittles. And our kids have seen that and done that. So being aware that just that one time could be it.
Oh, sorry.
No, go ahead.
There is a program that we do in schools called Generation RX, where we go in and teach kids, because oftentimes, is it candy or is it medicine? You can't tell. And so we are having those conversations, and that in itself is harm reduction, one piece of such a big part of what we're trying to offer to our community.
Information.
Information. I mean, even just you saying that you didn't know certain medications, you know, that you could take too many of, even if they were over the counter. So opportunities like that to educate individuals and at all of those points of contact, whether it's the doctor writing the script saying, hey, what I'm giving you is potentially addictive. So can we have that conversation now? Then when you pick it up from the pharmacist, hey, what you're taking has a risk of addiction or doesn't, or if you take it wrong or what, you know, interactions. There are so many opportunities for risk or harm reduction, risk reduction through every point of contact. So we have to make sure that we are hitting it at every angle.
And understanding, go ahead.
Well, and it's important to realize, so what I saw in probably my last 4 to 5 years in the criminal justice system in the courts with probation was people got scared from the fentanyl, especially 2017 when we lost 566 people to unintentional overdose. So, you know, if their brain is still saying you need a substance, but they're scared of using the substance, heroin, right? They're going to switch to something else. And what we saw was that there was a bit of a shift to methamphetamine use. But then what we saw was methamphetamine that included fentanyl, cocaine, and MDMA or ecstasy. So you think that you're using cocaine, and it was sold to you as cocaine, but it's actually fentanyl. Or even you think that you are buying fentanyl and it has xylazine or it has nitazine in it, which are, one is a animal tranquilizer, the other is not approved for any type of medical use anywhere in the world. And when you spoke about the Narcan resistant, those are two of the things that make Narcan not work as well if you're trying to help reverse an overdose. Because when you take an opiate, it depresses your respiratory system. And then the nitazine or the xylazine on top of that depresses it even more. So, you know, you think you know what you're taking when you buy it off the street, but probably 90% of the time you don't. You also have to think of, too, that when heroin was still a thing, and please let me be clear, there's no heroin in Dayton. And
People aren't dying from heroin overdoses.
Correct. There hasn't been heroin for years. It is all fentanyl. But at least with heroin, there was an organic piece of that. It was poppies and opium, and you had to collect it and you had to synthesize it. Fentanyl is completely lab created, and you have people making it that don't know what they're doing. So you could use a tiny speck one day and get a great high, and use the same amount the next day, and it's going to lead you to an overdose and possible death. So
I'd like to speak a little bit about risk. I think so there's risks that are there's risks with prescribed medications, with combining meds, with forgetting how much you took, with kids taking it, but then there's also with illegal drugs a different set of risks, because like Dawn said, there's no quality control, right? Like how many of us have gone to the grocery store and said, I want to buy this, but I'm going to see calories, ingredients, protein content. Like You don't get to do that with drugs,
Right.
unless maybe you live in Vancouver and have access to drug checking, but that's a different conversation. But when we talk about harm reduction, and I know this is a segue pretty soon, we're going to talk about a set of tools like Narcan, like fentanyl test strips. And so I think when we think about those tools, which are still, you know, only recently kind of being decriminalized and more accepted in Ohio, illegal drugs carry such a different set of risks because there is no quality control. Yes. And, you know, people who sell drugs, like dealers, I mean, there are some that do try, like that don't want their clientele to die, but they also have limited tools available to them. Like, it is just a risk ripe environment.
Yes.
And so no matter what, if you are using illegal drugs, then you are opening yourself up to a whole world of risk. You don't know what you're getting, you don't know what it's cut with, you don't know how strong it is. And so when we think of harm reduction as a set of tools and as a movement, it's oftentimes now associated with Narcan, fent strips, the Brave app, these special tools that have their own kind of like associations, like, oh, those are only, you know, for people who use drugs. But it is very important that we recognize those tools and distribute them in the community, because we need special tools. There's no label reading on the fentanyl. And so those tools need to be part of the everyday conversation until people stop dying of overdose, because
absolutely.
the risk is just so much greater. Like, there is risk for, you know, elderly or children or people who are just combining prescriptions and don't know. There's a risk if you have prescribed benzodiazepine and you drink alcohol. Both could be perfectly legal and you could overdose from it. Like, that is definitely true. But you also have the tools at your disposal to read how much % alcohol is your beer, how many benzos are you taking. It doesn't mean that you can't accidentally overdose, but you have a little bit more tools to your disposal to be literate.
Right.
Whereas if you're buying fentanyl, meth, a perk 30, which is probably not a perk 30, it's probably fentanyl. That's why we need the special tools that are associated with the harm reduction movement and the work that people like Victoria and Dana do in developing specific tools.
Absolutely.
I love that. So how do we keep our loved ones safe in the community safe? We talked about being aware, having the education, but how do I make sure my neighbor, you know, she's safe? Maybe she has her medication, she has some old medication. You know, how do I educate and let people know, hey, you know, this is out there, let's be aware. So how do I keep my loved ones safe? One, I have to talk about it. And I can't be afraid to talk about it.
Right.
Just like the young lady in high school. Oh my goodness, I about passed out with my niece. I picked her up, she goes, Aunt, what you said was real. And I was like, I said something. So she remembered, and that let me know she was listening. She goes, fentanyl is taking people out. One of my classmates was in the hospital. How come? And she was going to bring him to school. I was like, oh. And I said, I have to keep talking and continue talking. I cannot stop because I love and care about you. Do not fall for it. They may offer you certain things and you don't know. Like you say, it can be in like a little piece of candy. You never know, and that's how they get our children. But how do I keep my loved ones safe in the community? How do we work diligently to make sure that happens besides me talking about it?
One of the ways certainly is that many individuals do use drugs that are legal and prescribed to them, and we need to make sure that we're storing and keeping them safe. So we have a couple props and a couple things to talk about here. So the first, and these are all free resources available to the community, are these medication disposal bags. They're really cool.
Did you say free?
They are absolutely free, and don't we love when things are free, right?
Yes.
So super cool. You just open it up. You can put any unused old medications in there, fill it up with water, shake it up, and it deactivates the medication. So you're actually able just to throw it away versus leaving it out for someone to grab versus flushing it down the toilet. Certainly not sustainable for the environment. So it's a really amazing way to make sure that our drugs are being deactivated and safely disposed of. So these are available, and it's on a slide that actually is at the end of our time here today at the Montgomery County Adamus Board, again, for free to anybody in the community that wants them. We also have drug disposal drop boxes across the community. And so individuals can head to our website, which is preventionmc.org, again, at the end of our presentation today. And you can actually look up where the closest drop box is to you that you know that your medication is being disposed of correctly. So we just ask people, if you have medication you haven't used, to make sure that we're getting rid of that in a responsible way.
So don't save medication because you may need it for some other time.
Right, absolutely.
Don't save it because I might need to give it to someone else.
Right.
Please don't.
And someone else can find it. So that the kind of people that will utilize this, because I hear a lot of people say, I have old medication, it's just sitting around.
Yep.
So they can get these, they can contact you and get these bags,
Yep,
and then
absolutely.
they can actually throw these away. You don't have to go and if I can't get to a drop box.
Absolutely, yeah. And something that a lot of people don't think of is you can do the same thing for veterinary meds as well. So if it's not just for you, for your animals, the safe storage works the same way.
Okay.
And I'd like to build on what you just said. So you said, I need to hold on to this in case somebody else needs it. Just by educating people that that's actually illegal. If it's a prescribed drug, it is prescribed to you for a reason. So if you have Percocets from a surgery and your cousin comes in and says, I have a really bad headache, you can't go, here, have a Perc. So just, and a lot of people, it shocks me that a lot of people don't realize that.
They don't know.
Yes.
They don't know.
Yes.
And I think that's why it's important for us to model appropriate behavior. The fact of the matter is we are one of 2 countries in the world that allows our pharmaceutical businesses to have advertisements for our general community. So we need to model the appropriate behavior for our young people, for our family members. So we have become a pill-taking society. So if we have a child or a family member and they're like, I have a headache, it could be really important for us to say, hey, have you tried an ice pack? Have you tried, there are other alternatives to taking pills, and if we can model that for our loved ones, for our family members, talking about that, we can maybe make a shift in this direction that we're going. And so having those conversations, talking about it, when somebody asks for meds, talking about what, I have a stomach ache. Hey, have you tried some peppermints? There are other things that we can do, and we have a whole slew of different marketing materials and things that we have created to educate the community about how do we model that right behavior? How do we store it correctly? How do we dispose of it correctly? And then how do we have these conversations with people who are in active addiction about what the risks are? So somebody had mentioned the pills. 6 out of 10 pills that you buy illegally on the street have fentanyl in them. Or are fentanyl. So we have to educate everybody from young to the very old, to the people that are in the active mix, to the people that are trying to prevent it. We all have to be speaking the same language to make a dent in this.
Well, and like Colleen mentioned before, we'll get to some slides at the end, but spreading the gospel of the Community Overdose Action Team and the Montgomery County Prevention Coalition and Adamus. We want to make sure that people have access to those websites and those phone numbers, because that is what we are here for. So if you need assistance with getting linked with education, we can do that. If you need assistance getting linked with harm reduction, we can do that. I might link you to Dana, I might link you to Victoria. So really making sure that at the end of this program, when you see these websites and when you see these phone numbers, jot them down. Because that is what we are here for, is to help the community with as many tools and as much education as we can provide.
And early intervention is really important too. So educating individuals on what are those signs and symptoms. How do I know if my family member or my coworker, who may legitimately be taking a prescription, is misusing them? What are those signs and symptoms? And so educational opportunities and trainings that we'll talk about to teach people how to recognize the signs, because if you're not in it, you don't know. Right. And so not knowing is often the challenge. So if we can learn what are those signs and symptoms, we can intervene and help somebody before it impacts their life and they end up in jail or losing a job or worse.
And other places say it, but if you see something, you need to say something.
Yes.
How many times where you maybe see somebody who is nodding out on public transport or whatever, and you don't say or do anything. I know that it can be uncomfortable, especially if it's somebody that you know, or having that conversation with somebody that you love. But you're doing nobody any good by staying silent, especially the loved one. So.
But I think, go ahead.
No, I was going to say, this is where harm reduction really blooms, right? Because when we see that person, that we're not thinking about telling them, oh, shame on you, you shouldn't be doing that thing. Right. Our conversation is now changing. We're talking about, hey, I know these resources that you can utilize to stay safe. I know a place you can go if you want to go into treatment. Because what we recognize now is that it's not if an overdose can occur in someone's life, if they're going to be utilizing drugs in any way, it's when.
Yes.
And so if we are approaching it with like that harm reduction informed, that trauma informed set of tools, we're able to empower people, and we're not just shaming them into behaving in the way that we think is appropriate.
Right, right.
I was going to say the same thing, recognizing it as an opportunity, right? To not say, like, when you see those signs and symptoms, like Brittini said, or like Dawn said, is sort of acknowledging, not accusing, and offering, opening that door. You know what I mean? And by saying, hey, if you need this, it's not, the judgment is gone, and it's also not, are you doing this? I know you're doing this. If you don't stop doing, that's what makes people go use in an abandoned house. You know what I mean? And so when you kind of open the door and say, I acknowledge this may be a reality, and I'm here to walk with you and support you, that's harm reduction. That's the philosophy in action, you know?
Yeah, I mean, human beings naturally repel being told to do something. You have to go to treatment. You have to stop using drugs. It's just, if it was that easy, that'd be great, right? But, you know, that's not effective. And we're seeing it in our courts and in our criminal justice system, also in Montgomery County. You know, I think I'm so thankful that we have the leadership that we do in Montgomery County, because so many counties are still punitive and, you know, forceful. And we have a court, a seated court right now in our common pleas, also in many of our municipal courts. Probation director, you know, that sheriffs, you know, our sheriff and Sheriff Rob Streck and Dayton PD's chief, Kettering's chief of police, are no longer about that, let me punish you. And that's huge from criminal justice, which literally their job is to enforce laws. But when they instead say, you are struggling, how can I help you? That's huge.
Yeah.
Absolutely. Moving right along to how can we prevent harm? So what I'm hearing is I need to be educated and aware. So if I have medication laying around, I can contact you. And I want to hear some more information too as well. So how do I go about preventing harm? As me as a person, I know you have your expertise and they're ready to share. And I know we have some slides lined up. So I want to dive into those slides and give people the information right here so they can take it away with them as well. So we would go ahead and start our slide presentation, and you guys will inform us, all right?
Sure.
All right. We'll begin our slide production.
So, as noted, I'm the project manager for the Community Overdose Action Team. I am lucky enough to work with all of these ladies on one branch or another. And we do have 6 active branches. We have harm reduction, we have response, education and information, treatment and recovery, prescription, and harm reduction. I think I said harm reduction
Criminal
twice.
justice.
And criminal justice. So, you know, our goal is really to reduce the number of people that are dying from addiction and from overdoses. This is open to any interested person who would like to be a part of this coalition. This coalition is well recognized around the state. And also across the nation. So again, we're very, very lucky. I feel privileged to be able to lead it. And we have everybody from professionals in different situations like criminal justice. I've got, you know, assistant professor leading as one of my co-leads. But we also have doctors, we have dentists, we have lawmakers, we have people from different treatment, hospital, but we also have common citizens, you know, because again, you know, you're seeing a lot of the stuff that we are trying to actively work to help reduce and help change the way that things are going in Dayton. So,
And people with lived experience.
and people with lived experience,
We have to have them at the table.
Yeah.
Yep.
One of the things that the COAT has put together in conjunction with the SEND Innovations, Core Data, and other partners is an OD Surge Alert, which you're seeing right now. You can go to the Public Health, the Community Overdose Action Team website, and you can sign up for the OD Surge Alert. You simply need to text a number, put your number in, put your zip code in, and then every time there is an anomaly or there are higher numbers of overdoses in your area, it will let you know, and it will also give harm reduction tips. So, you know, if you are a person using drugs, or if you love someone who is using drugs, and you see that in our zip code or in our small area there have been a high number of overdoses, then you can really help prepare yourself, if you do have to continue to use as many harm reduction techniques as possible. I will let Colleen talk about this.
So I shared this a little bit already, and here is our number. Geez. All right. I shared this a little bit already, and here is our number to receive our free medication disposal pouches. So again, these are totally free to anybody in Montgomery County. You can use any sort of pill and very easily put them in the pouch, fill them up with water, shake them up, and then throw them out right in the trash. And you can call this number and request that one be sent to you, and that will happen from the Montgomery County Adamus Board.
Thank you. She also mentioned a little bit earlier about the DEA National Prescription Take Back, so I'm going to let Brittini take that away.
Looking this way still? Okay.
Sorry,
all right, yeah. So yeah, we have DEA Take Back Day twice a year. April 22nd, save the date. We will have some flyers coming out, as well as some other marketing materials. This is an opportunity. Maybe you don't have access to one of these nifty pouches, that you can bring your leftover medications, because we know we don't want to stockpile them, or your, again, animal medications, and drop those off at a safe location. We have DEA agents on hand that will take the medication and dispose of them. Believe it or not, we collected over 1,600 pounds of medication.
Wow.
Over the last, few years that I've been involved doing this, but it's tons of medication, tons,
literally,
that we collect at these events. So it's really important that we spread the word about those DEA Take Back Days.
Great.
Really gives our community members peace of mind that it's going to somebody that knows what to do
Yes.
with
Right.
it, and
Yes.
it's going to
Yes.
the right place. So
Thanks. So another part of public health is we have a treatment agency that is from intensive outpatient down called Recovery Services. Part of Recovery Services is a certified peer group that is led by Gary Ganella and Randy Carmack. And these peers work throughout Montgomery County. They can come to you or a loved one. You do not have to go to them. And they can assist with linkage to any treatment or services that you may need. So these are peers with lived experience of substance use. So they've literally walked in your shoes or in your loved one's shoes. They understand what you're going through. They understand, you know, the approach and the difficulties and the empathy that is needed. So if you are interested or know somebody who needs or need yourself any kind of peer support or guidance, you are welcome to reach out to the Public Health Outreach, either by visiting www.phdnc.org, or you can call 937-602-8020.
Project Dawn. Project Dawn stands for Deaths Avoided with Naloxone. It also stands for the middle name of a young lady who died of an opiate overdose on October the 3rd of 2009. She was from Portsmouth, and her mother stated that to her it's an honor to call it Project Dawn. She said, my daughter's gone, but her death is going to save someone else's life. Mm-hmm. And to me, that is the greatest gift that anyone that has lost a child, is to know that in that child's death, someone's life could be saved. Mm-hmm. And how is that life saved? It's saved with naloxone, which we know as Narcan. Mm-hmm. That when an individual ODs unintentionally, then a person that is in the room, in that space, can assist that person by giving them life, by helping them to breathe again, with the hopes that once they breathe again, that they will be able to go into recovery, which is what we call harm reduction. So if you need assistance, you can call me at 937-941-9277. I will even travel to you throughout the state of Ohio. And then you can also go on our website, which is www.sbhihelp.org, and get the training, and along with the opportunity of me sending you a kit to your address.
The wonderful thing about Project Dawn also is whether you reach out to Victoria or another Project Dawn coordinator in your area, the training is only about 15 or 20 minutes. So we're not asking for a half a day or a day of your time to get trained on this life-saving measure. It really, I don't think it's any different than an AED. If you see somebody that is having a heart attack and there's an AED, there's a good chance that you're going to use that on them. It's the same thing with naloxone and using the Narcan. So the good thing about Narcan, though, is if you think that somebody is having an overdose emergency and you give them the Narcan and it's not an overdose, it's not going to harm them in any way. So, you know, again, this is extremely important to get Narcan into the hands of as many people as we can, you know, and to follow up and make sure that you always have it on site, because you don't know if you're going to save a loved one's life or a stranger's life, but the ultimate goal is to save a life. So.
And you will travel. You said you'll come out
Yes.
to wherever they are.
Yes.
So local churches, anyone that's
Yes.
interested, please reach out to her. And we're down to our last couple of minutes.
Sure.
Ladies, you did an awesome job, but I want to leave everyone, I want you guys to leave your last words. What would you like to share within our community, and what would you like people to know? I would like people to know more about you and how they can get a hold of you. And they can do that because at the end of the slide of this television production, all the resources are going to be listed. So I'm grateful for you coming in and educating us and informing us today. So what would be your last you would like to leave with everyone in the community? And you don't have to go in order, however you feel. Just go right ahead.
I just want people to know that there are tools that are free that exist. So I work with Brave. We make overdose detection technology, and in the United States, there's actually 2 tools that somebody can use right now today. So if you have a smartphone, you can download the Brave app. There's also a number in the United States called Never Use Alone. And the Never Use Alone line and the Brave app are both peer-supported, peer-run. Those are the people answering the phones. It is a simple way for somebody who is in that moment of increased risk to be able to reach out, talk to an actual live human being, and that person can activate EMS response or a community-based response if they are unable to respond. So they're unresponsive, they're experiencing an overdose event. And it's just super easy. You know, it doesn't cost anything, and it's just an important tool to put in people's toolkits.
Thank you.
I would like for people to take away from this not only the different types of harm reduction and how you can get involved, but also to remember that addiction is the only illness that's treated as a character defect. Your brain is a very, very powerful thing. And when your brain gets used to a certain drug or feeling or whatever, it is very powerful in telling you that you need it. So, you know, somebody with a substance use disorder isn't somebody who is morally corrupt. You know, they are somebody, there's multiple reasons why people start to use drugs, and many, many times it is linked to either mental health, undiagnosed or untreated mental health, and or trauma, and a lot of times both. So that is an aspect that you need to think about also. You do not know what that person has been through that has led them to be where they are right now. So,
Tewanna, I want to bring it back to the original topic, why should harm reduction matter to you, and say, why shouldn't harm reduction matter to you? If you can have access to free Narcan, to a training by Victoria, whether you want to have that Narcan around for the elderly couple that lives next door, or for your cousin who uses drugs, or for the random person you see passed out at the bus station, it shouldn't matter. Like, who among you can find one of those reasons that does not fit? So why shouldn't harm reduction matter to you? Why wouldn't you take advantage? The community is really encouraging and embracing this movement of harm reduction. I feel like we want to be on this, wonderful TV channel and getting this audience because we want to share the message with a wide audience. Like, why shouldn't it matter to you, and why not carry Narcan?
Wonderful.
Yes. Go ahead.
I would just add that there's a seat at this table for everybody. We won't end this conversation, maybe not literally this table. But the Montgomery County Prevention Coalition and CODE are both community organizations. Our role on the Prevention Coalition is you have to live, work, worship, play in Montgomery County. And we encourage everybody to come and use their voice. You don't have to be an expert because you're an expert in your community and your people.
Right.
And you can help us reach out to the community in that way. So we hope that everybody takes the opportunity to have their voice heard and join us.
And I'll just close. If you are an individual experience addiction or a family member, you are not alone, and that there's help available. And we are just a minute piece of the amount of supports that are available in Montgomery County. We have a wealth of resources for you, and we are here for you. So please reach out.
All right. Thank you, ladies. It has been a pleasure. Did I miss you? Are you sure you
No, they wrapped it up very well.
Okay.
To try to say something beyond that would be,
Okay. All right.
they did an awesome job.
Well, thank you, ladies. Please, you guys, please feel free to reach out. Utilize the information that has been shared with us today. If you have questions or what have you, I'm sure they'll be more than willing to help you, or if not, direct you in the situation, or give you the access to all these free things that are right here in our community we had no idea that even existed. It has been a pleasure, and thank you again.
Thank you
Thank
so
you
much.
so much for
Thank you for
having
having
us.
us.